And with your post-op instructions, other than not blowing their nose or doing a modified Valsalva in the first week, any other instructions that you give them? In my experience with adults, there's not a ton of postoperative pain to treat. I mean, if they're getting an adenoidectomy, they're going to probably need some Tylenol, Motrin. But any other post-op instructions that are specifically related to the balloon portion?
Not really. It's extremely well tolerated. I warn the parents they're going to complain more of a sore throat from their endotracheal intubation than they'll complain about their ear or the back of their nose. So it's very, very well tolerated. If they have any soreness in the nasopharynx or ear, it's really temporary, a day or two. We talk about keeping the nose humidified if needed for comfort measures. But no, it's really the modified Valsalva nose blow. That's the main post-op instruction. Oh, and then after older kids, adults, after a week, I do encourage them to do the modified Valsalva. Let's get that ear aerated as quickly as possible. The swelling from the balloon is going to decrease over about 4 to 6 weeks after the procedure. So you do want to try to get that Eustachian tube aerated. So we wait a week, and then I start having them do their Otovent balloon or the modified Valsalvas if they can coordinate that.
And you tell them it could take you 4 to 6 weeks to notice a difference?
That's right, yeah. So I'll encourage them, wait a little bit of time before you jump on an airplane, for instance, if you've been baro challenged.
Yeah. Okay. And then for kids, they've got a lot of life to live, right? So is this expected, should we be able to do a dilation when they are 8 years old and expect that this should last, for the rest of their life, as long as, if we're assuming that other factors are controlled for. So if they, stay on top of their allergies or reflux or whatever else is going on.
Absolutely. Think of it as adenoidectomy in the Eustachian tube. You don't normally have to repeat an adenoidectomy. Occasionally it happens. Most common indication for repeat adenoidectomy is allergic disease. They didn't keep it under control. So you generally are not going to need to do a repeat dilation.
Yeah. So this is just another tool in our toolbox, right?
Absolutely. We've just got a technology which turns out to be very effective on treating adenoid-like disease inside the Eustachian tube.
Awesome. So as we round things out, in summary, balloon dilation is an effective additional tool to treat inflammation in the lumen of the Eustachian tube and can be used safely in kids as young as 8 years old, correct?
Correct.
What else?
Well, it's indicated down to age 8. And so it's all about, like everything else, choosing the right patients, making sure that you've got the correct diagnosis. These patients have issues with negative pressure. So it's middle ear fusion. So picking the right patient, it's a wonderful addition to our being able to treat a very common problem. And it gets to the source of the problem. So the rate of needing further treatments in our studies was very significantly reduced compared to just the natural history of repeated tubes. Repeated tubes don't treat the problem.